At the Urban Health Institute, we work across Johns Hopkins University to advance health and health equity in Baltimore via a wide range of programs, events, and educational and funding opportunities. So far, we've funded projects and programs doing amazing community work throughout the city of Baltimore. Community academic partnerships offer unique opportunities to draw from the respective strengths and expertise of academic institutions and community members. We are thrilled to support initiatives that enhance the well-being of our communities and create a more equitable Baltimore.
3 of our key initiatives include the Baltimore Health Equity Impact Grants, which have been funded for over a decade now, our strategic consultation grants, and most recently, our COVID-19 grant initiative. So our COVID-19 grant initiative was really funded around the central idea that we know that COVID-19 has disproportionately impacted the health of many of our residents here in the city. And so this is an area of high interest if we want to advance health equity.
Yeah, when the pandemic hit, I was particularly frustrated with federal response. There was a lack of communication, a lack of awareness of what needed to be done as far as like getting masks out to people. And I'm thinking about particularly in my community, there are a lot of people who are low income, a lot of elderly people in my community as well, who needed masks. And I knew that there were lots of amazing organizations that could support us with getting the mask out to our community. One of the organizations in the Greenmount West neighborhood is called Station North 2 Library, and they have a team of sewists. So they made over 1,000 masks. I'm really appreciative for all the love that we've been getting around our project. It just shows that we're actually doing something to make a positive change in our community.
For the Baltimore Health Equity Impact Grants, we're really looking for strong partnerships, innovative approaches to addressing health equity and improving the care of Baltimore residents across the lifespan and in spaces where perhaps we aren't typically providing health and healthcare services.
In a city like Baltimore, you see so much trauma, so many experiences that parents go through are going to shape the way that they experience their life and the way that they parent their children. So a program like the Chicago Parent Program is a great way to just give parents a support base and allow them to connect with other parents in their school community.
You can't do much to help children unless you also help their parents, because at the end of the day, children go home. There really weren't any good evidence-based programs for addressing the needs of families raising young children in low-income and underserved communities, and they needed that.
Being able to give them a different outlook and different strategies to communicate with their child, what the program is all about. It's been absolutely amazing. Families get so much out of it, and 87% of parents said that they were much more likely to participate in future programming.
Both students and parents feel nurtured, and schools are allowed to play an important part. They're allowed into the family. And we want the home to be a safe, nurturing, responsive place for kids. But you can't do that unless you also support the parents.
The Urban Health Institute is really working to connect community and community organizations to the faculty, student, and other resources that we have here at Hopkins to really amplify the work of community organizations and to center their needs and voice.
So the Emotional Emancipation Arts Initiative was done by Woundward Productions, and it utilized theater, cultural practices, various forms of performing arts to create a culturally relevant space for Black people to talk about the trauma associated with racism in the United States.
So it was a way of developing strategies to extinguish the lies of white supremacy and Black inferiority once and for all.
We do it with the performing arts. Arts and culture is a modality by which people can be healed.
Then each company group created a theatrical piece that related to issues of racism. And I think that was very powerful.
You know, it's an opportunity to show that creativity, that imagination, that the things that make us human can be part of the solution.
It is so important to have faith-based leaders involved because we know that they are already trusted agents in the community and already have very important community level ties that we need.
FAITH is an acronym that stands for Fostering African American Improvement in Total Health, and it is a cardiovascular health and wellness program that integrates community-based interventions to promote heart health. So racial and ethnic minority groups are disproportionately affected by chronic diseases such as heart disease, hypertension, diabetes, And we wanted to come up with a community-based strategy to overcome these disparities. And we decided that what's the trusted institution within the Black community, the Black church?
This program they knew was definitely going to work if they just had a shot to present to some people. And as a church, that's our responsibility. People were talking on Sundays about reading labels. That's why I remember it so well.
We also wanted to learn from them about what was important. You know, it's not, we can't just come in and say, do this and that. We need to understand where they were and what health challenges they're facing.
We have now over a decade of experience, and we've continued to grow. If we really want to achieve health equity, we have to meet people where they are.
Our strategic consultation grants are a really unique opportunity by supporting faculty members who are working directly with members of the Baltimore city government. For example, are there neighborhoods that are being disproportionately impacted by health inequities?
Baltimore is one of them. The cities which have a lot of problems with vacancies, and that includes vacant as well as abandoned lots. This is a major problem. Estimate is 14,000 or more abandoned lots. In consultation with the city, we selected 100 such plots. Asking is what is the quality, soil quality specifically. Using this information, they can have a better management plan, as well as they convert those vacant lots into green spaces. Is also it benefits the city as well as the residents.
We know that the fight for health equity in Baltimore is far from over, but knowing that our grantees are front and center in this effort and seeing some of their results, we feel confident in our efforts and look forward to what is to come. Personally, I want to thank everyone involved in today's program, as well as others we didn't hear from, but we know are working hard to advance health equity in our community. Reverend Martin Luther King once said, "All labor that uplifts humanity has dignity and importance and should be undertaken with painstaking excellence." UHI looks forward to supporting such labor with you. And today you saw a snapshot of that excellence. So thank you.